Thank you, Mr. Chairman. I just want to pick up on the same theme start with on the trend lines where we're heading right now. You know, according to the Commerce Department, inflation-adjusted incomes for middle-class families have dropped 6% just in the last decade. Meanwhile, the tax data show that the top 20% nearly 20% of income in the United States last year went to the top 1% of earners. That is the largest share of income going to the top 1% since 1928, the Roaring '20s. Now, economists agree that this kind of inequality is bad for growing an economy, but doctors, scientists, health researchers are now teaching us that this kind of inequality is literally deadly for our families. So what I wanted to start with is the question about what happens if these trends continue. If we continue to have an increase in financial inequality, what will be the impact on the health of families who are struggling to get into the middle class or families who are trying to stay in the middle class? Dr. Woolf, could you start us on that?
Well, I'm glad you brought it up, Senator Warren. The focus, obviously, in the last few comments has been on poverty, which is obviously of great concern. But these economic trends across the entire middle class of the United States also carry significant health implications. This trend of increasing income inequality and decreasing median household income has been going on for some years now. It's getting worse. And we know from a public health standpoint that carries important health consequences. What it means to Senator Sanders' point is that our children that are growing up under these conditions, we're raising a generation that's going to be sicker. And when we think ahead to what the implications are, besides the obviously important human toll that will inflict on that generation of higher chronic disease rates, that means a sicker workforce, a less well-educated workforce, and for American businesses, greater difficulty competing against other countries where they have less expensive healthcare costs and a healthier population.
Is there anyone who wants to add to that? Dr. Reisch?
Yes, I think, you know, we're talking about a situation right now which is creating a lack of mobility, both physical mobility and social mobility for millions and millions of people. For example, you know, it's harder and harder for low-income and working-class families and even middle-class families to go to college today. The cumulative amount of college debt now is higher than the total credit card debt in the United States. This is locking people into a lifestyle and physically into communities which we know are less healthy and you know, less able to access all the benefits of our society. 3/4 of all African American children who grow up in low-income neighborhoods will remain in those neighborhoods as adults. So we're talking about creating a permanent social stratification in our society, which is socially unstable, politically unstable, and economically damaging for our country because we're depriving our nation and individual people of being able to contribute to the economic growth, prosperity, and well-being of our whole society.
Thank you. And Dr. Berkman, did I see you wanted to add to that?
I was just going to say that to increase this, that the trend lines are bad, and we see this evidence in the Health and Retirement Survey where recent cohorts have increased morbidity, higher rates of diabetes, higher rates of heart disease, higher rates of blood pressure. We see it in children as well who seem sicker, are more likely to be obese than their counterparts a cohort or two ago. I think the most important thing when we think about this is that, and what you're onto, is that the social and economic policies that the government has developed over years that may be health promoting aren't counted as being health promoting. We don't think about that in the benefits side of the equation. So we only think about them in terms of the short-term economic turnarounds or employment or labor, when in fact the spillover to health may be enormous and kind of trump many, many other health policies that we have.
So let me pick up on this then, because what I'm hearing from all of you is that we seem to be caught in a vicious cycle here, that we've got struggling families are more likely to get sick, and once someone is sick, this puts even greater strain on the family, so that puts more strain on the family budget. It reduces the ability of parents to work. It causes further financial struggles, and we get a real downward cycle here. So the question is, how do you break out of that cycle? What are the options available to us to move away from this? And Dr. Berkman, you've identified one. You said if we changed our calculations on how we understand costs and benefits, that we could make different kinds of investments that would be financially sensible investments, But we've got to do a full accounting. What other ideas should we put on the table to be talking about here? Dr. Woolf, did you want to add something more?
We have an initiative at our center which we call Connecting the Dots, and it's basically this notion that Dr. Berkman's mentioning of understanding how these policies that are not conventionally thought of as health policies are vital levers for affecting health outcomes. One example I'll talk about is education reform. Our efforts to try to improve education, beginning with preschool, early childhood education, all the way through K-12, and helping our young people achieve a college education and graduate school education, are vital in a knowledge economy, but are also key levers in improving health outcomes. A lot of the socioeconomic problems that we're talking about here would be powerfully addressed by improving the educational success of our young people. The U.S. rankings on education are slipping behind other countries. We used to be the most educated population post-World War II. Now our seniors are the most educated seniors in the world, but our young people are falling behind not only industrialized countries, but emerging economies because of our shortcomings in education.
Right. Mr. Chairman, can I have just another minute to let others respond? Is that all right? I think Dr. Eberstadt wanted to respond, and I wanted to give him a chance.
Yeah, thank you, Senator. It's important to understand the role of social forces in health outcomes in the United States and elsewhere, but it's also important to understand the role of human agency, of lifestyles and behaviors and practices and outlook and attitudes and objectives. If social forces were really determinative, the Latino health story in America could not have occurred. We should want to understand how disadvantaged groups in America, how people with less privilege, less education, less income, sometimes have excellent health outcomes. I think that this is some of the low-hanging fruit in our situation today. One of the reasons, perhaps, that we don't know as much about this as we might has been that we have skimped on investments in social and economic data systems for our country as a whole. We were once not just the envy of the world with our educational results, we were the envy of the world with our statistical system. That isn't true anymore. We have held back on the investments in these data systems that I think could help explain much more what's going on in America.
That's very valuable. Are we still okay, or do you want to do another one? Dr. Kindig, sorry.
Just to build on that.
We'll be really short here.
Yeah, not only are the data systems, we just need the dollars to invest in research and understanding what are the most important factors. I mean, we're pouring zillions of dollars into studying which kinds of medical care factors are better than other, which drugs, which procedures. That's important work to do. I don't mean to bash that, but we spend almost no money on the questions before you here. What are the most cost-effective relative investments across the determinants so that we can get a balanced investment portfolio that will change the colors of these maps?
I just want to dig into this point a little bit more. Thank you. And that is, I was thinking about this. So healthy people have stable, safe, clean housing. They live in safe neighborhoods with sidewalks. They have lots of outdoor spaces. Healthy people can afford nutritious food. Healthy people have clean air to breathe. For many Americans, these necessities of good health are something that are luxuries they can't afford. So if we have a system that's not investing in these cost-efficient ways to keep people healthy, and a system that wastes far too much money treating people after they become sick, it's no wonder in this system that Americans are less healthy and die younger than people living in other wealthy nations. But I want to dig into that just a little bit more, Dr. Woolf, if I could. Can you tell us about the basic investments that other countries in the Institute of Medicine study make outside direct healthcare investments that have helped them achieve better outcomes?
Well, due to the paucity of data that Dr. Kindig mentioned, it's really hard to prove cause and effect.
Fair enough.
But we can see that these other countries that have better health outcomes have different policies with respect to some of the areas that Dr. Berkman mentioned, such as parental leave, maternity leave, early childhood education. We are outranked by other countries in the amount of resources they invest in early childhood education. Job support and workforce support for workers are more extensive in these other countries. Again, these are programs and services that help buffer the potential adverse health impact on families that we think might produce potential health benefits. But if I may step back out of my medical role, those are also policies that help people achieve a more stronger economic footing and increase their economic prosperity so that they could be more productive workers, more affluent consumers, and so forth, and therefore boost the economy. So it's a win-win, improving their economic footing and their health outcomes.
The virtuous circle instead of the vicious cycle. So maybe I can ask this in more detail, too, in another way. Dr. Kindig, I think in your written testimony, you talked about the Cambridge and Fall River, Massachusetts. You knew you would catch my attention with that. How they've made smart community-based investments. And so I want to ask you just to say a bit more about it and talk about how we could apply some of those same strategies to the broader population and what the major barriers are that stand in our way right now.
Right. Thank you for bringing up that point. The time limitation, I couldn't say everything that I wrote, but that was actually calling attention to a new program that we work with at the University of Wisconsin along with the Robert Wood Johnson Foundation. It's called the Roadmaps to Health Prize. It sort of is a companion to the county health rankings work that I mentioned before. And we are, the foundation and with our staff, are every year looking for those communities, not just the highest ranking communities. That's what our rankings do. They're the highest because they have all these things going for them. We're actually looking for American communities that have shown that they can be improving their health outcomes with a balanced approach like we've just been talking about. So not just in medical care, but actually in order to get a prize, you have to show excellence in the behavioral area, in the socioeconomic area, in the healthcare area, and particularly looking for multi-sectoral approaches. So when the two places that you, in your state, it was a little embarrassing to give two to one state, but you know, sometimes
we're working on it.
Yeah, I know. But in both of those very different communities, as you know,
yes,
but very remarkable partnerships coming together where the healthcare community, the public health community, the business community, community nonprofit organizations, United Way, sort of come together and say, we got a problem here to solve, and how can we pull together to do it? So that's what I mean, over time, this will be an ongoing, very high-profile program of the Robert Wood Johnson Foundation. Over time, with 6 every year, when we get 20, 30, 50 of these prize communities, there'll be real stories there that other places can emulate. And these are not the best-off places. Many of these are challenged. Like Fall River, for example, is a challenged community for many historical reasons, but they're finding a way to do it. There are stories that we can look to make progress. And thank you for bringing attention to that.
Well, thank you. And thank you for your bringing attention to it, because I think it's a reminder we can do this in the United States. We've got little pockets of where we've begun to build on the research that you all and the advice that you all have given. We just need to find ways to support it and extend it across the country. Thank you.